Another very important question is, why do COPD patients retain carbon dioxide when they are given supplemental oxygen? So it is believed that COPD patients breathe because of their hypoxia, and this hypoxic drive gets blunted when supplemental oxygen is administered. However, this is a misconception, and this is not the true reason why the COPD patients retain carbon dioxide when they are given oxygen. So the two important reasons why this happens is because of the VQ mismatch or increase in dead space ventilation, and the other reason is because of the Haldane effect. Let me just explain to you these two effects in short. So in COPD patients, there are a good number of alveoli which are not going to take part in ventilation because of the pathophysiology of COPD. Now, to maintain the VQ ratio, the body is not going to give enough perfusion to these underventilated alveoli by causing vasoconstriction in these perfusion vasoconstriction in the perfusion of these underventilated alveoli. So when you give oxygen to these patients or excessive oxygen, the oxygen is still going to reach these underventilated alveoli, and this oxygen is going to blunt the hypoxic pulmonary vasoconstriction that had happened as a protective mechanism, and the blood is now going to get diverted to these underventilated alveoli as well from the areas which were getting better ventilated. So now these better ventilated areas are going to receive less perfusion, causing to create an increase in the dead space ventilation, and which is going to increase the CO2 retention. Also, the second effect that happens is when you give excessive oxygen in these patients, this excessive oxygen, when taken by the hemoglobin is now going to start releasing excess carbon dioxide in free form of carbon dioxide, and also going to release hydrogen ions, which is going to worsen the acidosis, which is not going to get taken care of because of the increase in the dead space ventilation. This increase in the H plus ions and the CO2 in the blood is eventually going to go and cause CO2 narcosis or depress the respiration, and that is going to further cause hypoventilation and will further retain carbon dioxide. So it is these two mechanisms which retain the carbon dioxide. However, it is very important to remember that though we say the target saturation in our patients with COPD is 88 to 92% only, no hypoxic COPD patient should be devoid of giving oxygen. If your COPD patient is hypoxic, then you should give them oxygen, because this oxygen is required. Your target is 88 to 92 and not to make your patients hypoxic. Okay. So any other questions? Let me know.